Usama. Today we are going to talk about obesity. My previous lecture was about diabetes, then hypertension. I hope you guys are following that. So, what is obesity? When we talk about obesity, it is not just being about like overweight or having lean muscle mass or body fat. So, obesity is more sort of a chronic disease or a situation in which you are overweight, not just overweight, but overweight in sense of unhealthy body weight. If you have acquired unhealthy body weight, which means you have gained more body fats as compared to muscle protein and other like components of your body, like your bone density is low, your muscle mass is low, or your muscle protein is low, but you are gaining more and more fat around your body, around your organs over the span of years, that is called obesity. So what happens when our body starts accumulating fat? It leads to drastic changes overall, like a person's mental as well as physical health declines. We will talk about it later in the next slides, how it works or how obesity starts, and to what conditions they can lead to. So basically, one of the major issues related to obesity is that the unhealthy amount of fats that get stored in our body in the form of either uh, subcutaneous fat within under our skin, around our organs, and the other form of dangerous like cholesterol level in the blood or triglycerides. They are sort of lipids or fats that get stored in our blood vessels of the body, which can lead to stroke, heart attack, and other conditions as well. So we are going to talk about the obesity in detail. So is obesity defined by your weight or not? uh, I would like to speak to you. What do you think about obesity? What is it? Like, how can you define obesity? Anyone? Okay,
If you want to participate, you can
let's
write the
talk
comments
about
in the chat.
BMI. What is body mass index? So, whenever we talk about obesity, we have like sort out two or three criterion on the basis of which we say that this person is obese or not. So, one of the criteria we use like to define a person's obesity status, we use BMI. What is BMI? Body mass index. To measure the person's height, to measure the person's body weight, then we do certain calculation and then we calculate it like on the scale of 18 to 25. It is a normal range that we like put a BMI of, like if a person is having 18 BMI, that is totally normal. And person if the person is healthy, and if the person has 25 max, then that BMI range is also healthy. Like 18 to 25 is normal range of BMI. Below 18 is underweight, and above 25 we start categorizing that person as obese. Like then we start grading the obese person for the like grade 1, 2, or 3, like slightly obese, moderately, and highly obese, like a person weighing around 100 kgs, 150 kgs, but if we like relate to their height is short but they're overweight. So we call that person obese if that person's BMI index is sufficiently high, or higher than 30 even. So a person like if his BM is his her or her BMI ranges between 25, that is completely normal, to 30, we call that person slightly like healthy or overweight, but that person is not medically obese. When we start calling a person obese, that if that person touches the threshold of 30 BMI. So we are going to talk about BMI in detail in the next slides. We will see about its limitations and its benefits, like we how we use it in the medical science. So, BMI is a medical screening tool that measures the ratio of your height to your weight. So basically, we estimate the person's weight versus height. and we relate it like we have made it a scale that 18 to 25 is normal, below 18 is underweight, and above 25 to 30 is like slightly overweight, and above 30 is obese. So how we calculate BMI? We use like weight in kilograms divided by the square of height in meters. So we measure the height in meters, and then we divide the weight in kgs by height square meter, height in square meter. So these are the formula we use to calculate the BMI. There are two systems basically. In the US units, we use weight in pounds and height in inches. So multiply by 703. So this is how we calculate in the US units. For example, if the person weighs 150 pounds divide and his height is like 65 inches, so we calculate by using we do the square of 65, and we divide 150 by 65 square, multiply by 703. So this is the way we can use this formula to calculate the person's BMI in US units. And the other metric units that are more widely accepted worldwide, which are weight in kilograms and height in meters. And this way we calculate the person's BMI in metric units. It is very easy. You can do it in your home, like by using your by measuring your height, then measuring your weight, and you're calculating your own BMI. So BMI calculator can be used online as these days in browsers, Chrome. There are different websites that offer calculation of online BMI calculation by using, like, if you already know your height and you already know your weight, and you weighed like recently without any wearing any significant heavy things, like without heavy shoes, without heavy clothing. So if you measure the height and weight, then you can put in like a browser, and you can do it online as well. So these are the formulas written on the side in the imperial system versus metric system. So how we categorize the or use the person's BMI to classify that person in, like, medically, how we categorize that person. So there are five bands basically. Under 18, this is described as underweight. So 18.5 is the minimum threshold limit, like normal limit of the BMI. Then comes 18.5 to 24.9. This is called the healthy range of the BMI. Then 25 to 29.9. This is like slightly overweight person BMI. Then 30 to 39.9 is that person is described obese. Like 30 is the minimum threshold, we tag the person as obese person. Then 40 or more than 40 is described as severely obese, and that person should be actively treated in hospital, like by doing bariatric surgeries, by liposuction, or like different ways, like diet, by reducing dietary intake. So there are multidisciplinary approach to like cope with this kind of cases that are 40 or plus in BMI. So this is the BMI shown in the form of graphics, like underweight is 18.5. That person is too lean and have a very low amount of muscle mass as well as body fat. Then 18 to 24.9 is normal range. Then the person 25 to 29.9 is slightly overweight, and 30 to 34.9 we call a person obese. Then 35 plus, some books write it as 34, 30, 34.9. Some books write it as like 30 to 39.9. So when do we call the person is extremely obese? Let's say 40 or more than 40 BMI is categorized as extremely obese person. So what are the limitations of the BMI that we cannot use, like implement it like in every situation ideally? Because there are certain limitations that BMI doesn't define, like age and sex. For adults age 20 and older, BMI incorporates weight and height, but it doesn't take age or sex into account. So BMI is a general like measurement. It doesn't speak of age. Like don't we do not like take into account the person's age or sex, and they cannot be measured or identified like using the BMI. That some women tend to be slightly more obese than the men. But there is also, if we if I am talking about women being like a slightly obese, it doesn't mean that they are like they're overweight in something, but that fat distribution in females body is greater than it is in the males. So it is, let me tell you why. In females there is different hormones like estrogen, uh, and some other hormones like estrogen derivatives that that starts in puberty and lasts till menopause. And these hormones like make the female's skin's texture soft and like uh, a bit like and it also affects the fat percentage in the female body, like fats distribution in the female body. So the skin looks more younger, more like smooth in texture, and more soft. So this is the reason that females have like wider fat distribution than the males. So if we talk about age, the older people have more fat distribution in the body as compared to the young people. So this is a major limitation of BMI, that it doesn't take into account about the age and the sex of the people. So next one is fat location. If we speak of the fat location, the BMI doesn't signify that uh, like any specific area of the body where fat is accumulated. So it is in general that BMI is indicating like that you are overweight or underweight. It doesn't signify that either you are overweight due to fat deposition, or either you are overweight due to because you have gained more muscle mass. So it doesn't care about like fat location or anything. So there are other ways that we can like calculate that person's, that if they have fat around their waist and surrounding their abdominal organs, so that would be like health issue, that would be more health issue than the person who doesn't have fat in these areas. But if they have more fat in the subcutaneous area, that is like we cannot assess that person on the basis of BMI, either that they are having subcutaneous fat like fat below their skin, or if they are having fat around their organs, which is a more dangerous form of being obese. So stages of development, like regular BMI cannot accurately indicate the person's health at some stages in life. Like if you are breastfeeding and if you are pregnant, that BMI gets automatically invalid, because BMI doesn't speak of pregnant females. And if you are breastfeeding, that your age or your body weight doesn't like come into account. So childhood and adolescence, while person is still growing, uh, BMI is somehow still invalid, because some people tend to grow more taller as compared to the people of their own age. So uh, it is totally dependent on genetics. Like if person is growing or children is growing are growing, like if our child is like taller and slim as compared to the same age group of other children that are like slightly more, they have more moderate height and like a little bit of fatty or healthy. So BMI doesn't applicate to these like children and adolescents, during which these people this age group is like growing. So body composition, BMI doesn't differentiate about the body like composition of, like if look at these graphics, and you can appreciate this person have grown like more muscle mass and have well defined body. He is 6 feet as well as this person is also 6 feet. So this person has more fat deposition as compared to this person which has more muscle deposition. So we, if we speak of the BMI, both persons have 225 pounds of the weight and have like same BMI. We cannot differentiate that this person or this person, we will definitely categorize into the into like them into as obese persons, because both of them has like 30 BMI, as we already told that they are, if the BMI touches 30, then we start calling those people obese. But we cannot call this person obese because he has gained healthy body mass, because he has more muscles developed and have low fat percentage, as can you can see. and this person has apparent fat deposition in his body. So BMI totally gets invalid if we speak of like this kind of situations, like a person who has gained like uh, lean muscle mass versus fat body mass. So these were the limitations of BMI. There are alternatives that we can use to assess the person's obesity status or the person's body weight. Either it lies in underweight or overweight or in healthy weight range. So there is waist hip ratio or waist to hip ratio. WHR is the dimensionless ratio of the circumference of the waist to that of hips. If we measure the person's waist and then we measure the size of the hip, then we like take the ratio of these two quantities and it is unitless or dimensionless. We categorize on the basis of this circumference. So if let's take an example, if a person with 75 centimeter waist and 95 centimeter hips, or a 30-inch waist and 38-inch hips, has a WHR of about 0.79. So this is like normal. And these are the different like categories we as we did for the BMI. Now we are doing it for the WHR or waist to hip ratio, because if we have measured the BMI and we do not know how to utilize that data or how to relate that data to a person's like status, we that data is totally useless. And now if we have measured the person's waist and the measures and the circumference of the person's hip, and until we do not describe that data in the form of certain categories, that data is completely useless. So this is why we have categorized on the basis of like sex, and as well as health risk as well as body shape. So these are different body shapes like apple, pear, and avocado. So the waist to hip ratio in women, if it is 0.80 or below, it is the health risk is low, the body shape is pear. Okay, if the ratio is between 0.81 to 0.85, health risk is moderate, and its like shape is in avocado. Like if we speak of like fat distribution in females body, then you can see their torso is like a bit lean, and then their hips are about a bit like more have fat distribution as compared to the other body, because one of the reason is that they have wider pelvis, the other one is that they have more fat distribution around their thighs than their torso. So this shape is completely normal if we speak of the waist to hip ratio. And these kind of females like are less at less health risk. Then this kind of females have more waist, they are at moderate risk, and they have waist to hip ratio of 0.81 to 0.85. And these females that those have like that have even fat distribution in the torso as well as hips, they are very high risk of health risk. If we speak of men, there are different like categories, because their torso is a bit wide, then they have like waist a bit narrow. If the person is wider from his like shoulders and have like less narrow, or like have less ratio of pelvis, because they make like a triangle. If any of you goes to gym or like have that muscular body, you might be having like broad shoulders as well, like a small waist. So that is the ideal situation, like if you have the shape of a pear. So 0.95, that it is the ideal range, which shows very least high health risk. Then 0.9 to 1, that shows moderate risk, and then 1 or plus it shows very high or like health risk. So, how is childhood obesity assessed? So, some healthcare providers use BMI method to assess the person's obesity in childhood. But let's see how it works. Like there are different ways we can measure it. So a child's older than 2 years may be diagnosed with obesity if their BMI is greater than 95% of their peers in the same category. So different growth charts may present slightly different BMI averages based on the population they are sampling. So this is the BMI of a 10-year-old boy with BMI of 23 would be the obese category in 95th percentile or greater, and a 15-year-old boy with a BMI of 23 would be in a healthy category, 5th percentile to less than 85th percent. So let me make it easy for you. Like we speak of percentiles because we compare it with the other children of the same age group, and if the child's age is more than 2 years, and if his BMI lies greater than 95% among the same children of like in the same age, so that child would be categorized as obese child. So, how common is obesity? Let's talk about the trends. In American adults, last surveyed in 2017 to 18, that was the stats I got. Like the prevalence was 42.5, up from 30% in 1990 to 2000. So, there was a study conducted in 99 between 99 to 2000 and 2017 to 2018. So initially it was 30.5%, but it like that number grew to 42.5%. It means the obesity is the prevalence of obesity among the population is getting high day by day or year by year or decade by decade. So if we speak of the class 3 obesity means severe obesity, it almost doubled from 4.7 to 9.2%. It shows that the person who were severely obese, their number is almost doubled in this duration. So childhood obesity in America from 2017 to 2018 was 19.3%. These stats show like a population's obesity or the trends of obesity among the population in different ages, in different sex, and how it is like increasing or decreasing or if it is doubling. So these were the different stats that how common is obesity in these days. So future projections, like if we speak of future projections, like we can estimate the what is coming next, or how common obesity will be, or how these trends will go in like 2030, if we speak of that like trends go ongoing from previous decades. So expected increases like projections suggest that 20% increase in global obesity rates by 2030 if current trends persist. It means that if the situations remain same, that was in 2017 to 18 studies, if that situation persists, it means that there will be more 25% increase in the cases by the 2030 or 2030. So anticipate in advancement in AI driven personalized health inventions, potentially reshaping obesity prevention and management strategies. So there are different management policies, or different there are different proposals, like how we are gonna cope up with the obesity. uh, One of them is like running proper campaigns by controlling the amount of fats we are intaking, the amount our healthy lifestyles, promotion of the healthy lifestyles, and there are definitely a lot of other things that are needed these days to cut down this trend or this increment, because it is not just a one thing or one dependent, because obesity is multifactorial. Somehow it is also related to genetics, but a major I would say like 80 to 90% of the obesity is due to our lifestyle, our energy expenditure on the daily basis, our reduced cardio routine, as well as our like more and more fatty or like oily foods. So this can be controlled, because majority of the cases are acquired not due to genetics. So we can utilize AI in like future to run different campaigns, to promote healthy lifestyle, to promote healthy diet, to promote healthy exercises. So there are different uh, projects that we can like imagine in the future that can be utilized to cope up with the obesity trends in the population, because this is a major health issue. uh, we cannot, like as I told in the last lecture, that hypertension is a silent killer as well as obesity is. Unless the person's mental health is like getting a bit uh, compromised due to the body shape or the social issues, that person like completely feels themselves as healthy or whatever. Because if we speak of normal body weight, or if we speak about the obesity, and there is a lot of trends going on the social media that it should be cancelled, it is a hate culture that we are promoting. But if we speak of the medically, obesity is not healthy. So this is why it is very important to talk about obesity, to cut down weight. It is not just a negative speech or hate speech or anything personal to those who are obese, but it's just for their benefit, that they should cut down the weight. They should promote healthy lifestyle instead of normalizing the obesity. So it is very important to not normalize obesity, to not normalize over being overweight. So here are some direct effects of obesity, which includes which can be manifested in the form of different issues. Like it can directly affect respiratory system, it can directly affect our musculoskeletal system, it can directly affect our mental health as well. So if we speak of the respiratory system, if our chest wall gets like a bit thicker, it gets like really hard to like lungs to expand. So those persons can suffer from asthma, sleep apnea, obesity, hypoventilation syndrome. It means that person's lungs are not getting inflated as they should, because of their very thick chest wall, the fat around their like thoracic cavity, and fat around their rib cage. So they might have osteoarthritis, because of there is more wear and tear of the joints, because they have to bear a very tons, I wouldn't say tons, sorry, like many hundreds of pounds of the weight. So those joints undergo wear and tear very soon, and those persons might suffer from arthritis. You might suffer from back pain, you might suffer from gout. So there are different manifestations, like these were very general, uh, like these were direct effects of obesity. But there are hidden effects like obesity are, if you are having more and more fat around your organs, it is not healthy as well, because you're not saying that your organs are depositing fat around them. You are not saying if your blood have circulating fats as well, because they get like deposited around your blood vessels, and they block your blood vessels. So you might suffer from stroke, you might suffer from any necrosis, or your tissue starts getting dead, or anyone can suffer from heart attack, because if heart supply goes shut due to any blockage or any deposition of fats in the blood vessel, that this is also lethal. So direct or indirect, being obese is not like healthy and not normal. So uh, obstructive sleep apnea, it is a condition, and it is very common, and can be like easily manifested in more obese people. They are like have a trouble breathing, like they have more apneic episode. They might have like more snoring. They have might like a little bit have to exert more to respire normally, like inspire and expire. So in obese people, fat deposits in upper respiratory tract narrow the airway. This is increase, sorry, there is decrease in muscle activity in this region, leading to hypoxic and apneic episodes, ultimately resulting in sleep apnea. Apneic means like difficulty in respiration. So this is the normal airway, and as you can see, there is more fat. There is more and more fat around the neck. So these fat ultimately causes pressure around our like openings of the respiratory system, either externally or internally. So this is a obese person lying, and you can see the airway is almost closed here. And in normal person, you don't see any fat around the neck. And this is just a graphic explanation of this sleep obstructive sleep apnea. In real, it doesn't have to be like fat under the skin, but you might have fat around your trachea, your like main airway, around your blood vessels. So that thing also can compress your airways as well. So indirect effects include memory and cognition, including a heightened risk of Alzheimer's and dementia. So female infertility and pregnancy complications. One of the major complication in the females is PCOS, as well as there are other certain infertility issues. Females might suffer from subfertility, which is called as like not getting conceived after trying even after many years of unsafe sex. So there is depression and mood disorders related to the obesity as well. So certain cancers, including esophageal, pancreatic, colorectal, breast, uterine, ovarian. Studies suggest that these cancers are more common in females or men, those who are obese, as compared to those who are not obese. So breast, uterine, ovarian cancers are more common in females as compared to those who are not obese females, because let me tell you about little like pathophysiology of this issue. Is because in females, if someone is obese, uh, fat also secretes a female hormone called estrogen, or that hormone directly or indirectly affects the female's menstrual as well as estrous cycles. So these disruptions can cause breast, uterine, and ovarian cancers. Of course, there is familial predisposition, but these things are acquired as well. So link between obesity and mental health. So there are definitely two kind of effects. One is psychological and other is psychiatric. So psychological impact is stigmatization and social prejudice against obesity contribute to low self-esteem and body image concerns. So that person has low self-esteem and might suffer from social anxiety, or any like isolation or any separation. uh, Sorry, he or she might suffer from severe social stigmas, as well as social anxiety because of their own like body shape, or they might have low self-esteem, as they might think that we are not looking good enough, as being promoted on the insta, that those person who are gym fit or like have better body shapes. So social media also contributes to this psychological impact as well. So increased accessibility to conditions such as depression, anxiety, neurobiological factors or psychiatric factors as well, such which means like neural circuits and neurotransmitter levels related to mood regulation are also affected. Like there are certain chemicals in our brain that are regularized if we have normal body weight, if we do like regular exercise, and if we are like our body is functioning normally and we have normal BMI or normal body weight, so everything is working fine. So those persons have like totally might have totally sound physical and mental health. But if a person is obese, like he is not active as he or she should be, or if they are not exercising properly, or they not have like physical health, have a good physical health, so this is gonna affect definitely their like mood regulating neurotransmitters or chemicals that like boost or regulate our mood, such as serotonin, etc. So hormones are like leptin and insulin, integral to obesity, also play a role in mental health. One of the issues related to obesity is diabetes mellitus, as I already told that in previous lecture, that most of the cases like almost 50% of the cases are insulin resistant due to obesity. Or in simple terms, if the person like cut down their weight, their like diabetes mellitus also goes away. They are producing insulin normal levels, but the issue is due to obesity their cells are like getting more and more resistant to the insulin. They cannot use insulin to utilize glucose for the body, so the glucose gets deposited in the form of fats. So this is why obesity leads to a constant cycle of obesity with diabetes mellitus. So they goes on and on. Unless you cut down weight, you can also control uh, diabetes mellitus. So it is also a major health risk. So there are behavioral patterns that are associated with the obesity as well, because there are like binge eating, or there are different like other psychological disorders that affect the eating habits. So this can reinforce also obesity. And due to obesity, if a person like skips few meals of a day, and the next day he eats too much and like gets satisfied, so this is also a eating disorder. So the behavioral patterns also get distorted due to obesity. So quality of the life definitely gets impacted due to obesity, because of the physical and mental health, or significantly affected due to obesity. So this overall leads to like reduced quality of life, or you're not happy with the life. So it is very important to have like a multidisciplinary approach, that that person should see their counselor, the psychiatrist or psychologist, as well as they should see a doctor. If they are severely obese, they might see a bariatric surgeon as well. So it is a multidisciplinary or holistic approach that should be taken in those who are like obese or suffering from physical and mental health at the same time. So if we speak of the causes of obesity, there are many causes. One of them are genetic, behavioral, metabolic, and hormone influences on the body weight. So it is very understood that genetic predisposition is important, but there these three, four other factors that contribute more to it than the genetic factors do it alone. So behavioral, metabolic, and hormonal influences are that can be controlled, that are in our hand. So socio-cultural factors, genetic, psychological, behavioral, and environmental factors, as well as metabolic factors, these can accelerate obesity. So how is obesity treated? uh, you guys all already like you are aware of that, how we cope up with the weight that is unnecessary. So we do dietary changes, we intake like more fiber, more meat or chicken or red meat, so we cut down our carbs, we cut down our oily or fatty foods, we like switch to more fiber version, or as well as more like non-vegan version. So we have to make some dietary changes. We have to be more active. At least we should do cardio for 20 to 30 minutes, like in the form of either run or jogging or sprinting, or in any other exercise that makes you like a bit feel a little bit warm, in a sense that your heartbeat a little bit goes up, your respiration rate gets a bit higher. Like your body should know that you are doing something, you're exerting some force, or exerting, you are utilizing your body muscles. So you have to increase your activity, and even if you are like working from home, or you have very sedentary lifestyle, but if you like manage to get some 30 or an hour, 30 minute or 1 hour at least, for daily walk or sprinting or jogging or any form of cardio, so it is enough. So if you're doing it right, in right way, you may not get overweight or obese. So there are behavioral therapies as well, like counseling, support groups, and methods such as CBT may have a role to play in supporting your weight loss journey. So there are two things basically. One thing is, you have to, if you are not obese, you have to maintain normal weight. You can also follow these, like except behavioral therapy, you don't have to attend any behavioral therapy for that. You might have increased activity, you might have reduced or calorie deficient diet, which should be more fiber, more like any form of meat or fish, and low carbs, low fatty meals, So this way you can maintain your body weight in normal or ideal way. And if you are already obese or overweight, you have to make dietary changes. You have to like do a little bit exercise, little bit, or even may rigorous exercise daily on daily basis, depending on how obese or how much overweight you are. So there are behavioral therapies as well that like motivate you to do it. Are you doing it in the right way? So there are certain medicines as well that can help you accelerate the body weight loss journey. So these medicines affect your body in different way, but most of them are almost all of them are FDA approved drugs. And these drugs are not usually available as over the counter drugs. Most of them are like prescription bound. So you have to get assessed for your obesity status, then the doctor can prescribe you any drug depending on your situation. So orlistat is a drug like that. This reduces the absorption of fat from your gut. There are other drugs that decrease your appetite naturally. There are drugs that may reduce your cravings for the food. There are drugs that might suppress your appetite. There are drugs that might like uh, your that might speed up your metabolism so that any sugars don't get deposited in the form of fats. So these are the medicines that can be used against obesity. That was all about obesity. If you have questions, please ask.